Jarod Ward. I'm a holistic chiropractor here in Southwest Florida, serving Fort Myers area primarily is where my office is at. We might be expanding soon, so stay tuned. So I'm an applied kinesiologist, which is like muscle testing, and basically it looks woo-woo unless you understand neurology. So I use labs, so like whether that's blood tests, urine test, hormone tests, mold tests, you name it, we can order the test. We take the objective laboratory data, and then we take the patient and we're using their nervous system response to basically communicate with the body and see what the body is overly alarmed by or calmed by, right? There's only two modes of neurological activation. So there's two modes that your brain can live in. Parasympathetic, which is rest, digest, heal, and sympathetic, which is fight or flight, freak out, run. I'm just throwing duct tape on the airplane while I fly it, right? And so it can only be in one at a time. And so we can read the body and we can read the brain saying, okay, does mold make it go like this, freak out? Or is mold just kind of neutral? Because I haven't really encountered that a lot. It's not really a trigger for my nervous system, right? So we take the objective lab data and we take that light muscle switching tone to read the body of what do you individually react to, and when we figure that out, we can retrain, re-educate, and the body can heal. So we incorporate a lot of different tools in my office: muscle testing, nutrition, herbs, labs, chiropractic, because chiropractic is like the main thing that when done right switches the brain from freak out to calm and heal. And I always tell my patients, when you get an adjustment, maybe you switch to that healing mode for 2-3 days. Well, what if everyone in the nation was in healing mode for half their week? The amount of disease that we prevented just from that, right? So that's why the adjustment is really the backbone of what we do. Because when you're in that healing mode, now your body can use the herbs. It can use the nutrition a lot more than if it's stuck in the throwing duct tape on the airplane wings mode, right? So anyways, bird's eye view, that's what we do. I help a lot of hormone cases, a lot of digestive cases, ulcerative colitis, thyroid disease, Hashimoto's, estrogen imbalances, PCOS. Those are pretty much my cases. A lot of fatigue, low energy, parasites. We do all of that.
I feel like the fatigue is something that is so general, and I feel like when you perpetually work on your health, you reach a point that you've never been at before. So some people can live their whole lives fatigued, but that's their baseline, so they have no idea how they can feel.
Right. I kind of explain that like alcohol tolerance. Like if you drink every day, right, it's going to take a lot more drinks before you feel a negative effect, right? But if you hardly ever drink, you're a cheap date and 1 or 2 drinks, you're feeling it. Same thing with like natural medicine and health, right? If you're always in a toxic sludge or you're always fatigued, you're just going to get used to it. Your body is brilliant. It will adapt, right? But sometimes we don't want it to get used to a negative thing. So yeah, and fatigue's everywhere, right? It has to do with everyone's hormones are shot, everyone's toxic, no one has a normal bowel movement, and when that happens, you get sludgy, foggy, and fatigued.
What do you tell your patients, or what have you experienced in your patients as far as when they first come to you? How do you communicate that to them that I'm gonna basically change your life right now, and then how does that express through the healing process with them?
Yeah, so when someone comes to me, I tell them, so I only take on a case if I can work with them for 3 to 6 months, depending on how bad they are. I tell them 90% of the people who walk through my office doors within that 3 to 6 months, their complaints are completely resolved, right? I would say by completely resolved, like 90% better, right? Which is great. Like we might have to do a little maintenance here and there, but that's great. They're off their medications, right? They're not, going to the bathroom 12 times a day, or they're not crashing in the afternoons, things like that, right? So I tell them, if you can hang out with me for 3 to 6 months, you will be super happy. And then if you can give me a year, you will be better than you ever have been before. And it sounds too good to be true, but it's just true. So, I kind of paint that picture because it gives the expectation this is going to take time. You have 20, 30, 40, 50 years of bad lifestyle habits or just even normal exposure, like, eating at a restaurant or driving down the road, inhaling car exhaust fumes, right? You have that many years of exposure. You got to give the body like a year, right? I think we'll put out the fires in 3 to 6 months. You'll be feeling good. And then after that, it's all about optimization. So if you give me the time, we can do it. So, and if you do what I say, we can do it. So I think just painting the picture is really helpful for patients. And usually, so my appointments with the nutrition work I do are every 2 weeks for those 3 to 6 months, because I want to really control it, because that's how we get good results, right? And usually within the first 2 to 4 weeks, people are already noticing a significant difference with brain fog, energy, fatigue, etc. So if they don't do what I say, then we usually go backwards a little bit. But I mean, that's okay. It's part of the learning process too. But yeah, that's kind of how I communicate it.
So primarily this time, I want to talk about men's health, but there are a couple things that I wanted to kind of get reiterated from last time, because I think that they're just super hot topics. Okay. There's twofold. One of them is women's hormones and the other one is peptides. So just honestly, I don't even think I need to ask you questions about it. Just ramble on, sir.
Okay. So hormones are super fun. I realized in school, when I was in chiropractic school, that no one was really helping women's health from a natural perspective. And I started realizing the problems with birth control. I started realizing how even the, perinatal and birth process is basically monetized and capitalized, right? And it's not serving women or babies. And then I also started realizing that menopause is really, really difficult, and it doesn't have to be. So all of those things I started getting some complex hormone cases while I was still in my residency. Or they call it a clinical internship when you're in chiropractic school, but it's basically our residency. And so I started studying thyroid autoimmunity, because 2 out of 5 women in the United States have autoimmunity to the thyroid. When you have autoimmunity to the thyroid function goes down. When thyroid function goes down, you lose your hair, you get really tired, you gain a lot of weight, and you get constipated, because digestive function goes down as well. That would probably be like 70% of women who come to see me have 2 to 3 of those complaints I just listed. So, I just realized, okay, we really need to figure out hormones. And the thing about hormones is I kind of call them drama queens, because they react to everything, right? So if the blood, when we're working with hormones with women, I start with the blood. Is the blood sugar going well? Is there any infection, right? Because I believe a lot of thyroid autoimmunity is actually driven by infection, like for example, Epstein-Barr or mold toxicity, things like that. And the body starts wanting to pull out what's irritating the thyroid, right? And that turns into autoimmunity, but really there's something there, right? So anyway, so we work with the blood, we clear out infection, we balance the blood sugar. We work on maybe a little bit of detoxification, and we kind of level the foundations, right? We scrub the cement floors before we lay the carpet, right? And so then we get into hormones, and they can feel a little more relaxed because everything's a little more clean, a little more regulated, and things start to balance. And so whether it's PCOS, PMDD, if you know what that is, that's premenstrual dysphoric disorder or something like that, I think. I forget some of the names. Yeah. But anyways, PMDD, what else do I work with? PCOS, endometriosis, of course, all the menopausal stuff, but really any hormonal condition I can help with, because once you understand how the body works, it doesn't really matter how it's not working, right? Your little painting of dysfunction that you walk in with, I don't really care, because I have the original, right? I have what it needs to be like. And so if I look at this and compare it to this, okay, I know this so well, this is not right. And so we can fix it. But yeah, so with hormones, I love to do saliva or urine testing. The reason why, because hormones are dramatic. And when you take hormones in the blood, you see what's circulating through the blood, but we don't really rely on hormone function in our blood. We rely on hormone function in our tissues and our cells. And so saliva and urine are byproducts of the blood after it's gone through tissues and cells. And so I can then see more clear picture, not just how much hormone do you have in your blood, but what is it doing to your body and causing the symptoms and function, right? And so many times women will come in and they'll bring me their blood labs and, oh, see, everything's normal. I'm so frustrated. And then we run a saliva test or we run a hormone test and there it is, all the imbalances right there. And then we know what we're working with. So, yeah, that's kind of my approach. I've reversed PCOS in about 8 months. Well, their body reversed it. I just coaxed and encouraged and prodded, and the body did it, right? The body heals itself. I'm not really doing any healing. I'm just helping to remove problems, nourish. And when you remove irritants and you nourish the body.
It's funny because that is sort of the polar opposite of what I've been taught all my life from any traditional medicine practitioner I've gone to, is like, you're not in control of this. You need these things. Your body is doing this. So we need to, intervene at all these different spots.
I had a patient, she went on birth control briefly, then got PCOS, was having a cycle every 60 to 80 days. We cleaned up her liver, we nourished her ovaries, we nourished her hypothalamus for the longest time. I have specific supplements that will nourish the hypothalamus and only the hypothalamus, right? Which is the part of your brain that tells your whole hormonal system what to do, right? So anyways, but she told me, she's like, it took us about 8 months. We reversed her PCOS. She lost a lot of weight. Her cycle went down to every 28 to 31 days. She's like, my cycles are better than when before I went on birth control. So it's really cool what the body will do. But to your point with traditional medicine, right? Someone like her, they would have just kept her on birth control a really long time because it was regulating the inconsistencies or the painful periods, right? But it was actually making her system so much worse. So, and a lot of people know about birth control. People are waking up to that fact now, how it's actually carcinogenic and causes a lot of dysfunction. But anyways, yeah, that's just an example of how a lot of times unfortunately the traditional allopathic solution or the Western medical solution is to shut it down, cover up, instead of investigate, ask questions, ask why, and restore. And I speak from a place of understanding. My dad is a surgeon, so he does acute care. I have a value for Western medicine in its rightful place, but it's not the best at chronic conditions.
Yeah, and I think that's universally what I've heard from holistic practitioners is it's a balance of both. It's not one or the other, which is funny because that's how it's often pitted. Right. And I think I'm guilty, just because of I have experiences with traditional medicine that I, kind of project onto any given situation. So,
well, I'm really thankful. I've never had an emergency situation where I really needed Western medicine.
That says a lot about the state of your health.
Right. So that's really, I'm also young too, but, and I hope to never need it, but yeah, I just think a lot of times people are going to them for fatty liver or cholesterol imbalances or hormonal issues, and I really think there are no solutions there with those conditions.
Is there an age at which it is normal to fall into menopause? When should women be going into menopause versus when are they, and how do you know the difference?
I would say late 40s, early 50s. I had a patient who was 35 that she was told she was going into menopause, and I was like, that's insane. I suppose it's not unheard of, but yeah, I more prefer to see it latter half of the 40s, early, that's when things can start. But before then, I feel it's very abnormal. Something's wrong. So,
no, I know many women that are already between the ages of 36 to 44 on hormone replacement, and so it's interesting to know that. In your eyes, would you say that can be mitigated with lifestyle supplements?
Yeah. Well, here's the thing. I think everyone is really burning out their bodies more than they realize. A lot of women are running around on cortisol and frankly are addicted to cortisol, and they don't know how to not be stressed out on cortisol. And when you're running around on cortisol for so long, you actually don't feel hungry. And so when you're not hungry, the body, and you're not nourishing yourself the way you should, the body doesn't have what it needs to create hormones, right? And then you actually gain weight because your body's trying to save as much fat and energy as possible because it feels that it's in a calorie deficit. And then you start burning out your adrenals. And adrenals are really important for the hormonal system as well, because the ovaries, they create estrogen, progesterone, things like that. And the adrenals are more in charge of the androgens, which is cortisol and testosterone. But, well, they make DHEA, which goes into cortisol or testosterone. But basically what I'm saying is when you burn out the adrenals, you're removing a lot of your background support for your hormonal system, and all the burden is then on the ovaries. And so as you begin approaching, the 40s, whatever, the ovarian function begins to decline, and then the adrenals have been burnt out for forever because you've been running on iced coffees and no protein in the morning for forever, right? And so you're shot. And so that's why I call menopause or perimenopause the great revealer, because it reveals the dysfunction that you've been tolerating unknowingly for many, many years. And so I really think if the adrenals were nourished, taken care of, stress, lifestyle, stress management was a thing, you had enough vitamin C, because adrenals are the number one consumer of vitamin C in the body, more than the immune system, believe it or not. So if you had enough of those things, I think it would just be more of like a smooth, like, handoff. But unfortunately, that's not the case most often.
Interesting. Okay, it's funny. I'm like I'm ready to dive down that rabbit hole, but I know we have to switch gears.
I know we do, but just quickly, there's one patient, like, I was getting her cortisol to come down, and she's really struggled with her weight for a really, really long time, hardly eating anything, right? But just can't lose weight. Well, because there are 3 hormones that make your body gain weight: insulin, cortisol, and estrogen. And she's running off of estrogen and cortisol and insulin, really. So she has all these problems, right? As soon as I start to get the cortisol to come down, she starts waking up hungry. She's like, this is so weird. I'm never hungry. And so that's a sign of the metabolism beginning to rev up, the body actually asking for real nourishment, which is excellent, right? So that's kind of one of the first signs when I'm working with women who are having a hard time losing weight or balancing their hormones is hunger coming back? And are we then, eating appropriately?
The peptide situation. And here's what I want to talk about with peptides. You discussed last time we talked about how they're a turbo driver and how you have to fuel that race car really well if you want to drive it turbo. So we understand that aspect of it. What I want to talk about is the way practitioners are approaching it, how it has found, almost like a place in network marketing, and where, like, more of the foundational things that you need to do before you start them, and do you have to be on them forever? I'm sorry, I'm asking you 20 questions at once.
Okay, let's start with the way practitioners are prescribing. Typically what I see is any med spa that has a medical director is offering Ozempic, whatever, right? You go in, you get your first dose, you don't have any side effects in 2 weeks, you go back in, they double it, right? You don't have any side effects again for 2 more weeks, they double the dose again, right? Or, they 1.5x it or whatever. I think that's way too fast. Because typically in research, like the peptide can take about 6 weeks while you're on it before you start seeing that weight start to come off. So if you're already doubled your dose twice, by the time week 6 happens, you're kind of in a free fall, in my opinion. So I don't like that. They're usually not doing any form of like dietary counseling, or, they're not really monitoring someone's protein intake. They're also not really recommending any weightlifting, because here's the thing with Ozempic and things like that. There are stories in the media, of people getting osteoporosis, or like literally their bones are weakening from the lack of intake of nutrition from being on high doses of these peptide drugs, right? So what we want to do is we want to mitigate that, right? So there are different studies showing that, like tirzepatide, which it's a double agonist, or retatrutide, which is a triple agonist, meaning it acts upon 2 cellular receptors and 3 cellular receptors, versus Ozempic or semaglutide just acts upon 1 receptor. So I do prefer the 2 and the 3 because it's a more well-rounded approach. And they have shown that the 2 and the 3 are more similar in the body in terms of muscle wasting compared to just diet. So these are kind of equal. However, Ozempic or semaglutide is way worse with muscle wasting compared to just dieting, like Weight Watchers or whatever, right? So basically, all that to say, if you're going to do one, I really recommend tirzepatide or retatrutide because you're going to have you're going to have less muscle wasting than with Ozempic or semaglutide. And that's the main problem. Why is that the main problem? Because if you lose muscle, you're going to be worse off than before because muscle always burns fat. Muscle gives you energy. Muscle helps your immune system. Muscle helps your hormones, right? Muscle helps your bone health. So if you lose muscle, you're shooting yourself in the foot. So 1 step forward, 3 steps back is what a lot of people are doing with semaglutide or Ozempic. So anyways, that's why that really needs to be part of the program. And if that's not made clear to somebody, they're taking your money and breaking your bones. So that's practitioners. Next part of your question, remind me, please.
There's a segment of peptides, and you'll have to explain the difference between something like a weight loss peptide versus like health. I'll call them health optimization of peptides, where there's like a lot of network marketing around those. And I would love some education from you to understand: is it safe for people to take those? What is the same lifestyle rules apply?
So it depends. Every peptide is different. So there's about 80 different, I would say at least 80 different peptides, 80, right? So a peptide is just a chain of amino acids, which the body uses as signaling molecules. So cells send each other signals to cause a bodily response, right? That's how we function. Okay. The peptide is taking that cellular signal and copying it and injecting a whole bunch of that signal into the body to get a response, right? So is getting that response that way bad? Not necessarily. Is it the best way? Also, maybe not necessarily, right? So it's very individualized. So all of these 80 plus peptides have different signals. So it has to be, it's according to what you want. The 3 that I spoke about are the weight loss peptides or the burning fat, hunger, like satiating signals, right? But there's ones like BPC 157, which is the proliferation signal. So it helps your body lay down new fibers and new tissue. So for wound healing, or you can take it orally for like healing the gut lining, right? There's other ones like testosterone, which help burn off visceral fat and help retain muscle, right? So I actually like pairing that one with retatrutide or tirzepatide. But anyways, kind of like bird's eye view. It just depends. Again, like I don't recommend being on peptides forever. I recommend if you're going to do them, according to research, I think short-term and cycling is important. You should be working with a practitioner who's informed about peptides. But in general, I think it depends on your risk tolerance. I was telling my friend this the other day because he's getting pretty excited about peptides. And I was like, I wish you liked herbs as much as you liked peptides. Because a peptide might do one positive thing. It's one signal. But when you study herbs, they usually do 10 positive things.
There's like 15 different medicinal properties with single adaptation.
And no bad side effect at all. So it's like, and no safety risks. Right? Peptides still are a gray area in terms of like, is BPC 157. You can't take that if you have a history of cancer. You just can't because you don't want more proliferation or more growth of tissue, right? So I tell my patients, I'm like, yeah, peptides they're the gray area between natural medicine and pharmaceuticals because they're synthetic, right? And so you are manipulating your body to do something, which in certain cases, the benefit could outweigh the risk 100%, right? And so that's why I'm not against them, right? It's like also I'm not against someone, having surgery if they really need it. But yeah, anyways, like I told my friend, I wish people would study herbs the way they're studying peptides because, one, you can't patent them, right? But Gymnema. No one's ever heard of Gymnema. Do you know what Gymnema does? It's a blood sugar herb. You taste it. It literally numbs your taste buds so you can't taste sweet. So it reduces sugar cravings in diabetics and it goes into the body, all the insulin receptors on the cells, it repairs them. So when you have insulin resistance, it actually says, hey, little guy, it's okay. You don't have to be so resistant. Makes them sensitive again. I've had people's insulin numbers, like fasting insulin of like 60, which is awful. It should be like 12, be cut in half in like a month on Gymnema. So, and tirzepatide, retatrutide, yes, it helps with like the metabolic health and the blood sugar health as well. Sorry if I'm going like nerding out way too much, but I'm just like, Gymnema is amazing. Like that's amazing. And there's no bad side effect. So yeah, that's where I stand, I guess. If I do have my patients, if they are choosing to do peptides, I want them to be, supporting themselves nutritionally with their macros, with their herbs, with their exercise routines. But I do like BPC 157, TB 500. It's great for chronic injury.
Cool. Okay. So now we'll segue into I don't know. Like, let's take a swift right turn into
Take the exit, quick.
To men's health for time purposes. Okay. So I talked to a thermographer the other day, and actually, I think it's the thermographer that is working with you.
I hope so. I was going to say, what's her name? Yeah, I love her. She's great.
So we were talking about men's health, and she had a lot of, like, I won't say case studies, but just examples of how women's health have shifted since they started looking at thermography imaging. And I asked, what about men? And she was like, well, I don't really see men that often. They'll come in and then, they're gone. They're not, And so there was something that we kind of correlated in that, and it was that men don't necessarily proactively work on their health in the same ways that women do. And so I want to talk about that. I want to talk about your experiences with your male patients.
Yeah, I mean that's true. I think in the younger generations that's changing a bit. Like, I just think it is. Like 40s down, I feel like people are being more proactive. I think, for however strongly awful the lockdowns were and etc., I think that really created a lot of value for personal responsibility when it comes to health, because clearly nothing that was advised worked or was true. So that's great, right? But in general, men typically don't care about their health until they're hospitalized. And I think some of the marketing about health is part of the problem, because a lot of it's like feel good, self-care, and that does not resonate with men. Like, men don't want to feel like they need to pamper themselves. But men are interested in ROI, right? And so I think the marketing towards men needs to be like, well, what do you want out of your life? Right? And what are you doing to optimize yourself to get there? And do you want to be around for your grandkids or not? Right? And do you want to, I have patients who are having to pay out of pocket $2,000, $5,000, $6,000 a month for obscure prescription medications because of a strange diagnosis, right? And this is after Medicare, after their insurance, right? And we get them off of, their bodies heal and they no longer need the medication. I don't tell them to get off, right? They work with their provider for that, their pharmaceutical provider. But it's just like, I think people don't understand that really this is the more financially efficient way. It takes more work, but that's life, right? Men understand you invest in the stock market, you get a reward, right? You work hard at your job, you get a reward, right? The same thing goes for health, right? Put in the work in and get the reward. If you don't put in the work, you're going to be a statistic. And so I think that's just the cold, hard reality of nature and natural law. And so I think if marketing was a bit more, if messaging was more matter of fact, truthful, less appealing to feeling good, more appealing to hard value, I guess, for lack of better words, I think that could be helpful. I have some of the most macho male patients you could imagine, like cattle ranchers, contractors, and they value what I do. And we've reversed their diabetes together. We've gotten them out of pain. We've gotten them, their prostates were enlarged. So instead of peeing 6 times a night, they're down to 1 or 2, and that's life-changing for them, right? So, It just, I think, unfortunately, men have to hit a breaking point a bit later than women, which is a strength, honestly, right? Because they can keep going longer. Maybe it's a little foolish, but yeah. So I don't know if that answers your question, but I think it's a bit about messaging, and yeah. But when they're ready, they're ready.
Okay, so I want to talk about men's hormones. I hear a lot about testosterone replacement, but I know also there's like some issues with youth and hormones and testosterone. And so can you touch on both those topics?
Yes. So the first concept I want to introduce is called Pottinger's cats. I don't know if you've ever heard of that before. No. Okay. So Pottinger was a scientist of some kind, basically, and he had different cats, different populations of cats. Okay. The first population he fed whole food diet. This population, this group, he fed processed foods or like more processed cat food. By the third and fourth generation, I think it was the third and fourth, this side had incredible rates of chronic disease. This side did not. And then when you try, he kept breeding those same cats. And when he tried, I might be butchering some of the little details, but you'll get the point. But what's interesting, so he took those cats of third generation chronic disease, and he took these whatever. Anyways, he started feeding them the healthy diet. To reverse the chronic disease, it took 6 generations. So disease happens much faster than healing does, unfortunately, because you have to think about what reserve are you starting with, right? And so when it comes to our youth, I mean, we have parents who were fed processed foods their whole life, right? Growing up or whatever. And maybe they still eat that way, or maybe they're drinking, or they're, using a lot of cannabis, and there's no shame for any of that, but it's just like there is an outcome. There is a reaction, right? And so, of course, young men's hormones are going to tank because there's 2 things that always drive down testosterone: toxins and stress. Those 2 things. And then, of course, lack of nutrition, right? But those 2 things. And we're the most toxic time in human history, right? The glyphosate is insane in the food, right? The microplastics, whatever. I mean, you've probably seen those news articles about microplastics being found in testicles, in human testicles. So that is, yeah. So yeah. When I read something and I see it a couple times, I think everyone has. But yeah, microplastics have been found in human testicles and in human semen. So microplastics are everywhere. So that's impacting cellular function, right? Your brain, your pituitary gland, signals the testicles to make testosterone, right? People's brains are messed up, right? Everyone's on dopamine addiction, right? So I think it's a huge problem, sitting in screens all the time, right? Because when is testosterone made? It's made at rest, right? And so if sleep is disrupted, testosterone production is disrupted. And if you're scrolling on your phone, you're looking at blue light all the time, you're impacting melatonin production. Melatonin production, if it's not healthy, you're not going to get as good of sleep. You're not going to have as good of cancer resistance even, and you're going to have low testosterone production. So you're fighting these toxins. Everyone's super stressed out with all the negative news, negative media, busy lives, and you're not sleeping and you're not recovering. So muscle and testosterone are built in recovery, not necessarily stress or work, right? So I mean, there's the perfect storm, right? And so nowadays, I can't remember the exact statistic, but a 25, 30-year-old male has as much testosterone as his grandpa did when he was 70 or something like that. It's crazy. So I mean, people are doing TRT again to try to inject themselves to counteract this onslaught upon the human body. It's a band-aid, and I get it. Sometimes it's life-changing for people, and okay, fine, but I guess I just want to know, like, I mean, if there's a lot of toxins and that's why my testosterone is low, well, a lot of toxins can also mean liver dysfunction, gut dysfunction, or cancer. So let's get rid of the toxins because it's going to help my testosterone and everything else, right? The thing is, people a lot of times want the quick fix, and that's fine. I'm not the doctor for them.
If a man is to a point where he's being recommended testosterone replacement therapy, what are the things that he could do to avoid that?
Well, they're recommending it really early. So I mean, you have any, because they want a patient that's going to be on TRT for a while, right? And And if you feel great, great. I mean, I have friends who work in the industry and I respect them, but one is the guy lifting heavy 3 times a week. 2 is eating a diet rich in, beef, for lack of better words, beef, antioxidant rich foods like pomegranate, things like that. That's what I would try first, for that nitric oxide support too, just blood flow support. And then selenium, right? Selenium is involved in sperm production. So Brazil nuts are really a good thing to start incorporating in your diet. Chop it up, put it on your yogurt, whatever. Are you getting enough protein? Things like that. How's your blood sugar? Blood sugar is going to, impact a lot of hormonal function. Because here's the thing, when you're overweight and your blood sugar is dysregulated, fat makes 2 things. Well, more than that, but 2 things I'm going to talk about. Extra fatty tissue in men makes estrogen. So that's going to compete with your testosterone. And it's also going to make something called interleukin 6. Interleukin 6 is literally an inflammation driving marker. So you're just going to be more inflamed if you have more fat. And people don't realize that. And they're like, oh, why is my back hurt? Or like, why am I getting heart disease? Well, because you're literally have an inflammation making factory in your gut, right? So anyways, I'm losing my train of thought a little bit. Where are we going with?
No, I think you're good there. And I think that
things for people to try. So if you can get rid of some of the excess weight, getting sun on your back increase testosterone by like 200%. You can look it up, PubMed, look it up. It's cool. It's like going outside shirtless, working out, eating rich foods, that can all be very, very helpful.
It's basic. It's not always the same answer because there's variations inside holistic health, but the foundations of it, man or woman, it sounds like it's the same. It's circadian rhythm. It's eat the right diet. It's get more protein. It's move your body. It's do resistance training.
And I mean, I can make a lot of herbal, calm down. I could make a lot of herbal recommendations too, but I mean, Tongkat Ali is really good. You need a methylated B vitamin, lots of things like that, that you could dive into. But I had one patient, he came to me, he was on TRT, yet he still had no libido. And this guy's like in his 30s, no libido, was starting to deal with a little bit of like erectile dysfunction even too. So super strange, right? Like that is way too early. I mean, it's always abnormal when that happens, and he was on TRT. He was doing like, I don't even know, a pretty substantial dose per week, and it wasn't working, right? So he came to me. We did my labs. We did my, neurological muscle testing, applied kinesiology. And what we found through our testing was he actually had a very sneaky, low-grade bacterial infection in his testicles. When we cleared out the bacterial infection...
How did you find that out?
Muscle testing. Mm-hmm. So when we cleared out the bacterial infection and when we also nourished the testicular gland with a specific product that basically gives the body the blueprint of how to repair and provides a protective like covering over it, so to speak. When we did those 2 things, because whenever I'm working with an issue, I like to clear the irritant, whether that's toxin or infection, and nourish the organ, right? So we did those 2 things. Turned around. It was great. And his libido was back. He didn't have a problem anymore. So, and he was actually able to decrease his TRT. I think he's still doing some, but he was able to decrease it about by 50%. So that was really cool. And that's a case that shows you like TRT is not the end all be all. It can be for some people, but not for everybody. Mm-hmm. And a lot of times men who are on TRT aren't doing the proper maintenance to continue it, because when you're on testosterone replacement therapy, it can cause your red blood cell production to go up. And so when that happens, that means you're more likely to have cardiovascular related issues like a stroke or a heart attack, right? So you need to actually give blood because your blood becomes too thick. And a lot of times they're not even doing that. And so it's like, okay, who's monitoring that? Like if they were my patient, like, do you want your penis to get hard? Or do you want a heart attack? Like you can't. Yeah. Like let's prioritize. Let's prioritize. Okay, I'm not letting you have a hard penis until we get rid of some of your extra red blood cells. Okay, you're cut off until you go do the maintenance protocol, right? So I'm being silly, but yeah, there just needs to be a little bit more making sure the patient is okay.
Yeah. let's talk about blood and let's talk about cardiovascular health because I think it is a huge problem for men. And yeah, what do you see with that, and how do you see that shift?
I love this topic. So I have one of my best cases that was actually completely virtual. This patient was in Washington, in and out of the hospital with heart attacks, and we just met on the phone. And I kept, ordering his labs, looking at labs, and we reversed all his problems. He's never been in the hospital since. But the problem is, here's the thing: the heart has several different areas where it needs nourishment. Okay. One, it needs electrical control from the neurology of the body, from the nervous system, because the heart is an electrical system and the brain is what tells it to either speed up or slow down, right? So that needs to be okay. And the thing that supports the heart rhythm and electrical system is healthy whole food B vitamins. So many people are deficient in B vitamins and don't even realize it. I'll run B12 and folate on most of my patients, and they're usually like 50% of what they should be. They should be like 600 B12, and they're like 300, and which is like on the way to having disease from nutritional deficiency, and people don't realize that. Like, my dad's a surgeon, right? The amount of people that he can't operate on because their basic vitamins are so deficient is insane. People think people like me are just pushing supplements, but I'm like, well, you literally are like 2 steps away from rickets or whatever, right? So we have to do something. People just aren't getting enough in their food. They're like, well, I want to get it from my food. I'm like, well, you're not. We ran your labs. I don't know what to tell you. Like, ideally, yes, but that's not happening, and something's wrong. And so, yeah, anyways. But that's why I use all my supplements are food-based anyways. So, because what heals the body? Food. Food and nature.
And I think people don't realize, I talk about this a lot, but I watched a documentary a few years ago called Need to Grow, and it was about farming practices, reducing the nutrients in the soil, and how, one, our farmable soil is going down, but two, our food is significantly less nutrient dense as a result.
There's no micronutrients in the food anymore. It's sad. Anyways, where was I going? Oh, electrical system of the heart, B vitamins. And then the heart's a muscle, right? So calcium is what helps the heart contract, all muscle contract. So if you have cramps at night, leg cramps, Charlie horses, whatever, think calcium. If your eye starts twitching, calcium, okay? It almost fixes it every time. But so you need to get calcium into the heart muscle, and the heart needs specific healthy fats to get that calcium into the heart muscle. So when you do those things, you fix a lot of it. I think heart disease is so preventable, but it's the number 1 killer in the United States still. But I think it just fails because people's inflammation is insane. They're not managing their blood sugar. They're drinking, and drinking is inflammatory, but it also robs your body of B vitamins, which you need, right? And then, they're not getting the nutrition they need.
Interesting. So it's come up recently, this whole like calcium score with the heart thing. I never had heard of that. And can you talk about that and what like reduces it?
It's a really cost-effective screening procedure to basically see like how much calcium is building up in the arteries around the heart. So it's a way for, people to basically look at their risk of heart disease. So it's like usually $75 at an imaging center. And it's a good indicator for how inflamed have you been for how long, basically. Because the body throws calcium at inflammation because it wants to like patch it up, right?
Interesting.
So,
because you were just saying like it needs calcium, but I'm like, right. What is the
right?
Okay, so
right.
it's not getting there properly, or the inflammation is
correct. It's too much inflammation. And how does the heart get inflamed? Infection, blood sugar dysregulation. I'll say those main 2 things. Mm-hmm. There's different species of bacteria that will live in the heart valves. And Lyme disease, I find a lot living in the neurology or the heart valves. So if we can clear some of those bacteria out of there, sometimes we can get better function. I had a patient, she had a congenital defect, which means like she was born with a heart problem. And the doctors told her that it would never get better. And a measurement of like heart health is called ejection fraction. It's basically a measurement of like how much, every time the heart pumps, how much blood does it push out, right? And for her condition, it would be expected that her ejection fraction would gradually go down over the course of her life, right? But actually, she started working with me, and it went like this. And the doctors were like, that's crazy. That should not have happened. You were born with this problem, and the body is beginning to heal it, and your heart function is actually improving. This is a miracle. And so stuff like that is cool, and she's a patient for life now because, so, and she's just on a few supplements and getting adjusted. Like, well, she's getting adjusted once a week now, but she was just getting adjusted once a month, and we got those results. So
it's hard because, and I'm sure you deal with this every single day. You have to watch people in different states of unhealth, I guess, unhealthiness. And like you talked in terms of ROI when it comes to men. But how do you, like, what specific things do you do? Because, when it comes to wellness, it's basic things. It's, less chemicals in your home. It's better food, and these things to people that have reaped the benefits of wellness seem really basic, but to people that have never really dug into it before, they're so like, that's a bunch of bullshit, or everything gives you cancer these days, or everything's bad for your heart, or there's so much different advice, like just, screw it all. Like, what do you tell people to, like, I don't know, can you convince them? Like,
no. You just can't.
It's tough.
You can't. And it's just, my question is like, why are they saying that? Are they overwhelmed? Is that what's going on? Like, what? Because clearly everything is unhealthy. Like, look at the data.
Literally everything is giving you cancer.
Right. Everything is giving you cancer. Childhood obesity is way up. Everything is bad. I mean, whatever. So it's just like, okay, so I think that it's not a facts issue. It's an emotional readiness issue. And if someone's not emotionally ready, you can say all the facts in the world and that will not move them emotionally, right? And so I think convincing someone is less about data and more about interacting with their psyche in a constructive and strategic way.
Yeah. It's funny because I'm in marketing, and so I'm always looking for the way to touch people. And I find pain points are such an effective way. Like, they have to experience the pain, and then you have to say, this is the solution to that pain. And then once that one pain point is like, oh, then that's a light bulb moment. And then you sort of go like, what other light bulb moments can I have?
Right. Well, in my new patient intake, I always ask one question. I say, I want to. They'll come in with a huge list of things they want help with, right? And I tell them, I want to help you with all of this. But in the first like time of working together, which one would be your biggest win? Because I want to get you your biggest win first. And because I tell them this could get discouraging at times. So I want you to feel encouraged by getting the biggest win. And they tell me, and that's what we work on first, if possible, right? Yeah. If they're like, if they're diabetic, whatever, and they're like, oh, well, I want to lose weight. I'm like, well, to get there, we have to do some other things first, right? Within reason. But it's always about, to your point, solving the biggest pain point first, winning their trust, because I'm trustworthy, but they don't know that yet, and that's okay, right? And proving to them that I am who I say I am, and then, continue to help them, their family, etc.
All right. What other problems do men come to you with as far as like their bodies go, their stressors, are we just going to go around in circles and talk about the same things over and over again when it comes to like men's health, women's health, anyone's health? Do you feel like it's always like, here's the basics.
Typically, and it just shows up a little differently. I mean, I have men with panic attacks, sexual health concerns, weight, diabetes, peripheral neuropathy.
I have an interesting question.
Yeah.
How does porn impact men?
Well, porn makes them constantly run off of dopamine, and exhaust the dopamine producing cells, I think a lot of men who are addicted to porn, this is a strong statement, may end up developing neurological diseases like Parkinson's.
Where does that association come from?
Because Parkinson's is rooted in dysfunction of the dopamine producing neurons of the brain. So if you're exhausting them for 10, 20, 30 years, wearing them out without providing pointed nutrition, I guess I don't, it's my theory a bit, but I don't know why they wouldn't fail first, and then them failing first or being the weak link in the brain would show up as Parkinson's.
For men in any stage of Parkinson's, have you tested that theory at all?
No, I don't have a ton of Parkinson's patients, to be clear, and that's more of a recent thought of mine. And I'm not, and I think more than one thing can hurt those neurons. So I'm not saying that every person with Parkinson's has been using porn, because that I think Parkinson's can also happen from a lot of the toxins and chemicals used on golf courses, for example. There's an association there as well. So take what I'm, everything. Everything is not as black and white as it appears, I guess is what I'm saying. But yeah, that's what I do wonder. And then, of course, just like in terms of like, if you're always on a high of dopamine from using, life is going to be a lot more bland because you're used to artificial, right? Artificial highs. It's like drugs, right? Mm-hmm. It's like you're stimulating your brain way beyond what it's supposed to be stimulated by naturally. And so then everything natural feels a lot less.
So is that the same situation then with cannabis use?
Well, cannabis impacts blood flow to the brain in a negative way. Okay. So it reduces blood flow to the brain. I don't think that's a good thing. Especially if you're like a daily user, right? You're restricting blood flow to the brain. That's never a good thing. So, but in terms of like the neurons that it's impacting, I actually don't remember which neurons cannabis is impacting.
Okay. But, overall, what would you say are like the things that you have noticed in men that are like regular habitual cannabis? I don't want to say users, but
what do I notice in men who are using cannabis regularly?
Yeah.
Oh, okay. Well, cannabis is estrogenic, so increased estrogen, lower sex drive, lower motivation, lower how to explain it? Slower dexterity of thought. Like the ability to think quickly seems to be diminished. Or like to tie pieces together, right? Yeah. And I don't know if that's just because lack of blood flow to the brain consistently leads to that. Yeah. So, I don't care if someone uses cannabis, like to be clear, but this is just kind of what I see. Of course, it's relaxing for people, but it's like, are you relaxed or are you drugged?
I think with anything, it's everything in moderation. And I still sometimes will smoke pot here and there, but it's definitely what I've noticed as I've gone along on my health journey. It's that my desire to have anything mind altering when I live so like on a high, I don't know how to sound whatever, but like live on a high frequency so often now, I don't really want it. And so that I think is the biggest, in my opinion, benefit of it, because people are like, oh, switch to these THC drinks, or like, get your medical card. And I had my medical card for a long time, so I'm not knocking it if someone needs it. But it's my goal with this to move people just further along that path to their, like higher vitality, so that they don't need all this.
Well, and I view it as, this is a strong word, I view it as crutch, right? Which is fine. Sometimes we all need crutches, right? But do you need it forever? And if you do need it forever, then maybe we should think about that. Yeah. So, I mean, that's kind of my thoughts on it.
Pieces of basic advice for men when it comes to their wellness. Where can they start?
If you're not lifting 3 times a week, lift 3 times a week. Figure out a way to do it. Get sunshine. Eat red meat.
Even with cardiovascular issues?
Oh yeah, 100%. Yes. I beef is so nourishing to the body and to the heart too. I'll put a lot of my patients on like beef heart supplementation so that they're getting some of that heart tissue orally to help strengthen their heart.
Speak to that misconception then, really quick, of the fats of red meat being negatively impactful on the heart.
Well, there's a huge myth that dietary cholesterol means your lab cholesterol will go up. That's just not true. It's been disproven over and over and over again. But that's why, really Western trained doctors will be like, don't eat eggs, don't eat beef, don't eat butter, because they think that the fat will cause further lipid imbalance. But that's not true. Cholesterol markers are more a measurement of liver function, blood sugar handling, and levels of inflammation in the body. Because what is made from cholesterol? Hormones. And so if you're having hormonal dysregulation, the cholesterol will begin building up, because what converts the cholesterol into hormones? The liver, right? Also, cholesterol nourishes the brain. So that's where like the whole avoid dietary cholesterol comes from, because they think that cholesterol automatically means you're going to have a heart attack. I don't think so. Yeah. So that's kind of where I come from. That I just don't think it's not true. If you look at the data, it's not.
So if someone is experiencing high cholesterol before eliminating these, what a lot of people would say healthy fats from their diet, what is the move then to detox liver?
Yes. I'll put them on my liver detox, and usually cholesterol drops like 30 points in 3 weeks. If it's not the genetic familial hypercholesteremia. Mm-hmm. If it doesn't drop, then it's familial, it's genetic, you're fine. Okay? There's 3 ingredients that cause heart issues, right? Lipid imbalance, okay? Blood sugar fluctuation, and inflammation. You are very much in control of your inflammation and your blood sugar. You usually are in control of your cholesterol. There is a genetic one where you're not, but then, okay, you have one ingredient. Just that, one of my mentors, he always says, you need oxygen to create a fire, but just because oxygen's in the room doesn't mean there's going to be a fire, right? So same thing with cholesterol. You need it to have a fire. You need it to be one of the 3 ingredients, but just because it's there doesn't mean you're going to burst into flame, right? So that's my story with cholesterol. They also scare people with like the little a cholesterol. I don't know if you've heard of that one, but basically it's a small one that like can get through the blood vessel wall a little easier. So they think that one can create more inflammation, and it's a little bit more familial or genetic, and it can create problems with the heart. But what they don't tell you is that people who have that one also typically are very, very long lived, because it crosses into the brain and nourishes the brain longer than the person who doesn't have high amounts of that. So it's like, okay, yeah, maybe you need to be a bit more mindful of your inflammation and your blood sugar health, but then you might also have a very long, healthy life, because your brain is going to have more healthy fats getting to it than people without a higher amount of that. So
Interesting. I think the moral of the story is that more people than they realize should be going to holistic practitioners to try and see if they can go different routes, especially before considering like surgery and stuff like that.
Yeah, or even just like get your labs read by someone like me, right? Because I'm going to pick up on stuff. Like I have people all the time, oh, my labs are normal. And they come in and I'm like, no, actually you have 50% of the B vitamins you need for optimal health, right? Do you want, yeah. So just get your labs read by someone who knows how to read them from a functional perspective. That's a great first step. And like you can do that once a year. That's a good, easy step, right? I prefer my patients to be a little bit more proactive than once a year, but that's a good starting point for those who haven't done anything yet and don't know where to start.
Cool. All right. Well, thank you.
Thank you.
Yeah.